You go further medially from the infratemporal fossa through the pterygomaxillary fissure, you enter into a very small fossa which is called the pterygopalatine fossa. So the idea for today's talk is to look at the infratemporal fossa, the contents of the infratemporal fossa, and the important contents of the infratemporal fossa includes mandibular nerve, you have the maxillary artery and its branches, you have the muscles of mastication there, you have the aortic ganglion as a parasympathetic ganglion there. So those are the important structures which we are going to discuss. And then next week we are finished with the head and neck, so we would go into the neck region. So this is probably the most high yield area in terms of the testing in head and neck for the head region. So we are going to talk in detail about the infratemporal fossa. There's also a joint there which is going to be discussed, which is called the temporomandibular joint. So there will be a lot of discussion on how this joint is formed, what are the different types of movement, the stability of the joint, and the muscles which are related with the movement at this joint. So we'll start with a little bit of revision on the bony structures so that you orient yourself where the infratemporal fossa is and what are the different parts of the bones in terms of skull and the mandible. So we'll go through a little bit of the review of the osteology before we start into the infratemporal fossa, talking about the boundaries and then the contents of the infratemporal fossa. So let me start with a little bit of the bony landmarks. This is a skull which you are seeing from the lateral view. And the first thing which you can see here is this bone, which is the ramus of the mandible. Then you have this area which is called the coronoid process of the mandible. And this is the condylar process of the mandible or the head of the mandible. Then you can see this tubercle, which is the articular tubercle. And this articular tubercle prevents the head of the mandible to move forward beyond a certain point. When you're opening the mouth, this head of the mandible is going to slide forward, but it can go up to the articular tubercle. Beyond this, if it moves forward beyond this, there will be a dislocation of the mandible. Then you have the mandibular fossa, where the head of the mandible is articulating. So this is the mandibular fossa. There is the angle of the mandible. There is the body of the mandible, which is this. This is the styloid process. You have the mastoid process here. You have the zygomatic arch, which is this one. You have this fossa, which is called the temporal fossa. And this temporal fossa constitutes only one muscle here, which is called the temporalis muscle. And this temporalis muscle's tendon will pass through the space between the zygomatic arch and the skull and will be inserted on the coronoid process. So the temporalis muscle is going to pass from the temporal fossa through the arch and will be inserted on the coronoid process. So there's nothing much here in the temporal fossa except the muscle which is the temporalis muscle. So this is the temporal fossa. These are the two temporal lines, the superior temporal line and the inferior temporal line. Inferior temporal line gives the attachment to the muscle, and the superior temporal line gives the attachment to the fascia or the epineurosis, which is going to contribute with the epineurosis in the skull. So the superior temporal line is going to give insertion to the temporalis fascia and the epineurosis. Inferior temporal line gives insertion to the muscle itself. So the muscle is coming from all this temporal fossa and it is going down and getting inserted to the coronoid process, and the muscle is known as the temporalis muscle. Superior and inferior temporal lines we have talked about, and this is the maxilla. So you should know all these structures here. This is the pterion, where you have the coronal suture the squamous temporal bone, the sphenoid bone, and the frontal bone joining together. So this is the teleon, and on the inner aspect of the teleon, you know that there is middle meningeal artery. Also, there is an artery which is running in the temporal fossa, and that artery is called the superficial temporal artery. And sometimes there is vasculitis of this artery, which is called the giant cell giant cell arteritis, or the vasculitis of the superficial temporal artery, and that will result in pain and throbbing pain on the side of the head, and also difficulty in opening of the jaw, or the pain in opening the jaw, as well as pain on the side of the head, and that is called giant cell arteritis or the vasculitis. It's an autoimmune disease. It's a vasculitis of the superficial temporal artery. Okay. This is again a quick review of the mandible. So this is the ramus of the mandible. This is the angle. You can see the body of the mandible. This is the head of the mandible, or the condylar process, and within this constricted portion of the head of the condylar process is called the neck of the mandible. And the neck of the mandible is related with two important structures. One is the auriculotemporal nerve, which is a branch of the mandibular division of trigeminal, and neck of the mandible is also related to the maxillary artery, the first part of the maxillary artery. Then you can see the coronoid process, which gives attachment to the temporalis muscle, and then the pterygoid fovea is basically a fovea or depression within the condylar process. It gives attachment to the lateral pterygoid muscle. You have the mandibular notch here. You can see the lingula, which is a projection of the bone above the mandibular foramen. This is the mandibular foramen, which gives entry to the inferior alveolar nerve and inferior alveolar artery, which supplies the lower teeth. You can see this mylohyoid line, which gives the attachment to mylohyoid muscle, which forms the floor of the oral cavity. This is the submandibular fossa. The submandibular fossa lodges the submandibular gland, and this is the sublingual fossa, which lodges the sublingual gland. And these are the alveolar processes of the mandible. And then this is the mental protuberance, and this is the mental foramen, which from where the mental nerve and vessels are going to exit out. In elderly men and women, when they lose their teeth, there is resorption of the mandible, as especially the alveolar part of the mandible is going to resorb. And you can see that mental foramen, the location of the mental foramen. Here the location of the mental foramen is on the body. Here it is coming on the margin. So because there is resorption of the bone because of the loss of teeth.
Doctor, why does it improve for the
When you lose teeth, the alveolar, the bone is going to resorb, because you start to lose the gingiva, you start to lose the teeth, and then the bone is going to resorb. So this happens in elderly persons. Okay. So now we are going to talk about the infratemporal fossa, and we said the space underneath the temporal fossa and the medial to the ramus of the mandible. So the ramus of the mandible, if we take it out, we are entering into the space which is called infratemporal fossa. And also it is communicating with the temporal fossa through the space between the arch, the zygomatic arch, and the skull. So that space through which the infratemporal fossa is communicating with the temporal fossa. You take the ramus of the mandible out, you are basically entering into the infratemporal fossa. Now you should remember that the infratemporal fossa is formed by, it has a roof, it has the lateral wall, it has a medial wall, but it does not have a floor. In the in the floor, it is communicating with the neck. So the triangles of the neck are going to communicate in the floor of the infratemporal fossa. So there is a lateral wall, there is a medial wall, and there is a roof. The roof of the infratemporal fossa is formed by the infratemporal surface of the temporal bone and the greater wing of sphenoid. So these are the two bones which are going to form the roof of the infratemporal fossa. And in the roof of the infratemporal fossa, there are two important foraminas. One is called the foramen ovale, and this foramen ovale is going to transmit 5 structures: mandibular division of trigeminal, accessory middle meningeal artery, lesser petrosal nerve, and imaginary veins. 4 structures are going to pass through the foramen ovale: mandibular division of trigeminal, accessory middle meningeal artery, lesser petrosal nerve, and imaginary veins. Mandibular division of trigeminal is the third division of the trigeminal. Accessory middle meningeal artery is a branch from the maxillary artery. Lesser petrosal nerve is a branch of the glossopharyngeal nerve, and imaginary veins are communicating veins which are communicating the pterygoid venous plexus with the cavernous sinus. Okay, so one is the foramen ovale, and the two important structures from foramen ovale should not forget. One is the mandibular division of trigeminal, and the other is the lesser petrosal nerve. So the rest, if you don't remember accessory middle meningeal artery or imaginary vein, doesn't matter. But mandibular division of trigeminal and lesser petrosal nerve, you should not forget. The second foramina in the roof of the infratemporal fossa is foramen spinosa, and it is transmitting an artery which is called the middle meningeal artery, which is also the branch of the maxillary. And the second important structure which it is transmitting is a meningeal nerve or meningeal branch from the mandibular nerve, which is going to supply the meninges within the middle cranial fossa. So it is also sometimes called nervus spinosum, because nervus spinosum is basically a meningeal branch from the mandibular division of trigeminal. It supplies the meninges in the middle cranial fossa. So those are the two structures in the foramen spinosum. The third foramina, which might open in the roof of the infratemporal fossa, is called the petrotympanic fissure, and petrotympanic fissure is going to lodge a nerve which is called cauda tympani. So cauda tympani is going to exit out from the petrotympanic fissure, and it is going to join with the lingual nerve in the infratemporal fossa. So these are the 3 major things which are present in the roof. One is the foramen ovale, the other is the foramen spinosum, and the third one is the petrotympanic fissure. Ovale, at least remember mandibular nerve, the spinosum, middle meningeal artery, and petrotympanic fissure. Yes.
Doctor, we don't consider the foramen lacerum and the carotid canal?
No, that is not in the roof of that is more medially located. So it's not in the roof of the infratemporal fossa. So in the roof of the infratemporal fossa, there are 3 major openings: spinosum, ovale, and petrotympanic fissure. Yes. We will show you in a minute. Let me just finish the theoretical part, and then we'll show you a lot of pictures. Okay. The lateral wall is formed by the ramus of the mandible. So the ramus of the mandible, once you remove it, you are entering into the infratemporal fossa. So the lateral wall is formed by the medial surface of the ramus of the mandible. Medial wall, on the other hand, is formed by the lateral surface of the lateral pterygoid and also the pharynx. So medially there is pharynx and the lateral surface of the lateral pterygoid plate. And then medially it also communicates through a pterygomaxillary fissure into the pterygopalatine fossa. Contents: you have the lateral medial pterygoid muscle, mandibular division of trigeminal, cauda tympani, the parasympathetic aortic ganglion, the maxillary artery, the pterygoid venous plexus. So these are the contents, and we will discuss them in detail as we go on. So now let's look at the structure. So we have removed the ramus of the mandible so that you can look into the infratemporal fossa. And what you are seeing is that this is the lateral pterygoid plate. So this is forming the medial wall. This is the ramus of the mandible, which is forming the lateral wall. Then you have the pterygomaxillary fissure, and you are entering into this fossa, which is the pterygopalatine fossa. So medially you can go in, and medially if you go here, there is pharynx here. So we will show you. The first picture is you are looking from the lateral side, and the next picture which we are going to show you about the infratemporal fossa is going to be, we'll take the skull from the back out, and you are going to see from the posterior aspect. So you are going to look at the infratemporal fossa from the posterior aspect. At the moment you are looking at from the side. Okay? So this is the lateral pterygoid plate. This is the ramus of the mandible, and you can have this ligament which is arising from the sphenoid bone going to the mandible, so it's called the sphenomandibular ligament. And this ligament is coming from the styloid process, the angle of the mandible. So this is stylomandibular ligament. So the first muscle which you see is this muscle which is coming from the inner aspect of the lateral pterygoid plate. So the medial aspect of the lateral pterygoid plate, this muscle is arising, and it is attaching to the inner aspect of the angle of the mandible. This is called the medial pterygoid muscle, and this is the deep head of the medial pterygoid muscle. The superficial head of the medial pterygoid is arising from the maxilla and going to the inner aspect and attaching to the angle of the mandible. So we are constructing the muscles now from deep to superficial. So the deepest structure which you would see if you take out the ramus of the mandible and all the superficial structures, you would see the medial pterygoid muscle. It is arising from the medial surface of the lateral pterygoid plate and from the maxilla, and it is attached on the inner surface of the angle of the mandible. The next muscle, which is very important, is arising from the roof of the infratemporal fossa, and this is the upper head of the lateral pterygoid muscle. Lateral pterygoid muscle has two heads. The upper head is arising from the roof of the infratemporal fossa, and the inferior head is arising from the lateral surface of the lateral pterygoid plate, and both heads are going to go and get attached to the fovea, which is present on the head of the mandible, or the pterygoid, the condylar process of the mandible. Now, the two heads of the lateral pterygoid are important because we divide the maxillary artery, which is entering into the infratemporal fossa, by the heads of the lateral pterygoid. So the first part of the maxillary artery would be behind the neck of the mandible. The second part would lie above or below the two heads of the lateral pterygoid, and the third part of the maxillary will enter into the pterygomaxillary fissure and enter into the pterygopalatine fossa. So there are three parts of the maxillary artery. The first part is behind the neck of the mandible. The second part lies over the top or below the two heads of the lateral pterygoid, and then you see the third part of the maxillary entry through the pterygomaxillary fissure into the pterygopalatine fossa. And each part of the maxillary artery is going to give 5 branches, and that's why, just for description, we have divided this into 3 parts. Although we are not going to discuss all the branches of the maxillary, we will just, try to keep ourselves focused on the major branches of maxillary. But for your purposes, you should know that 5 branches come from the first part, which is behind the neck of the mandible. Then 5 branches come from the second part, which lies over the top of the lateral pterygoid or below the lateral pterygoid. And the third part enters into the pterygomaxillary fissure, into the pterygopalatine fossa. Okay. Then you can see the pterygomandibular raphe, which is here, and from here the buccinator muscle is arising. And then you can see the branches